Hello and welcome to Healing Our Communities. I'm your host, Dr. Susan Margaret Murphy, President of the West Virginia Drug Intervention Institute. And I've just been informed that this is our 30th episode, so we're reaching a milestone today, which is very exciting. But also just wanted to take a moment to extend our condolences to the family of Emily Ferry. You might recall that Emily was on our last episode. She worked with the Institute as one of our education and outreach coordinators, and unfortunately has passed after a short illness. And so we're still reeling from her loss at the Institute, but really wanted to extend condolences to her family and friends, and we're going to dedicate this episode to her honor. So today we have with us a new staff member, Macy Withrow, who is our new education director at the Drug Intervention Institute. We're very excited to have her here with us to talk a little bit about prevention education, her work at the Institute, and her background. So welcome, Macy.
Hi.
We're so glad to have you on the show today. So we want to start with just a few questions for our viewers, just to get to know a little bit about you. And so we'll just start with that. Tell us a little bit about you and what brought you to the work at the Institute.
So I'm originally from St. Albans, West Virginia, so right here in the Canal Valley. I went to WVU. I studied sociology and women and gender studies and communications. I graduated in 2021, and I previously worked in the after-school space. Kind of want to keep in that nonprofit area, so that kind of led me to the DII.
And we've been very excited that you come to us with that experience working with young kids, because we talk a lot to young kids about prevention and medication safety. Talk a little bit about how your previous work has prepared you for this position.
I think that anytime working with kids just kind of broadens your horizons in general. They teach me more than I teach them, I think. So I think that just gives you life experience, but also just working with families that have people in recovery or even in active addiction. And I think that it's a really interesting aspect to learn that from the student, because they might not know any different, and that's just their normal. So I think that that's really the best education that I could get.
And you've been working with kids in what age groups?
Well, in the after-school program that I was in charge of, it was mostly kindergarten through fifth grade, but
Wow.
I've really worked K through 12. I was kind of wherever I needed to be.
And it's kind of hard because you have to create special messaging for each of those age groups, which we'll talk about in a minute. That's always a challenge. And kids are so brutally honest.
Very much
They
so.
will tell you exactly how you look on any given day.
Yes, they will.
And sometimes they want to go home with you.
Oh, of
Sometimes
course.
they want you to go home. So it just kind of, you never know what you're going to get when
Never
you're working
do.
with young kids. What advice do you have for younger professionals who might want to do this kind of work?
I have some friends that are in the corporate space, and I think that it's so vastly different. I think that a lot of the work that we do is based off of passion, and based off of, just your genuine love for people and the people that we serve and the people that we work with. So I think that that's the biggest thing. I think that passion and compassion is our power in this work. So if you're not passionate about it, if you don't have that connection or that drive, it might not be the right fit for you. But if you feel passionate enough about the issue at your organization, I think that that'll take you anywhere you want to go.
So let's unpack that, because you're kind of a new professional and therefore a new prevention specialist in this space. And so you've been on the job for about 30 days now. It seems longer, but it's been about 30 days. The 30 seems to be the theme for today's show.
Yeah.
What is something that has surprised you thus far in this work?
I think that just the preventionist community that exists, that I didn't really know too much about before getting into this field, and the kind of support that everybody has for each other, I think that that's really amazing.
Yeah, you've been able to attend lots of different meetings with folks from around the state.
Yes.
Talking about prevention education around the issue of substance use disorder. So I think it's great that we have that collaborative relationship, because we can all learn from each other.
Yeah,
too.
and I think that knowledge is power. So I think that that's the best thing for us, to just be able to sit down and have a conversation. Like, these are our issues. This is our goals. I think that's an amazing thing.
And a lot of people who are listening might not know that we have a very high proportion of young people in West Virginia who have been impacted by addiction. We have a lot of children being raised by grandparents, being raised in foster care, in many cases as a direct result of the opioid epidemic. And so, unfortunately for these kids, substance use disorder was kind of normal in their homes. And so, talking with them about making different choices and how they can make those different choices is so important. So talk to us a little bit about the programs that you're specifically responsible for at the Institute.
So I'm responsible for the Don't Keep Rex Around, the medication safety program, and also kind of spearheading the Healthy and Creative Brain and trying to get some residencies in the Charleston area for that as well.
So tell us a little bit about Rex.
I actually have Rex with me.
You brought him with you.
Rex, he is obviously a medication bottle, and he talks about the responsibility that students have to be safe with prescription medication and over-the-counter medication, and kind of how they can stand up for themselves and also kind of teach their guardians, maybe we shouldn't have this on the counter, or maybe we shouldn't have this on our bedside, see, stop, say. That's his slogan. So if he sees something, you have to stop and say something to a trusted adult.
So the whole thing is based around talking to a trusted adult, and we know that the opioid epidemic really started because people were, in some cases, very innocently sharing medications, and then people became addicted. You know, somebody would have a back injury, and then somebody else in their house broke a leg, and they said, well, this worked for me, you try it, and then we just ended up down this path of addiction. And now we're looking at a very different opioid epidemic. A lot of people turned to heroin. But now we're also seeing counterfeit pills. And if you look at the numbers of youth that are taking counterfeit pills, whether that's Adderall to get through and study for an exam, or having what they call pill parties or things of that nature. And so letting kids of all ages know that they need to be safe with medication or anything that looks like prescription medication is really important. And we know that Rex really started with pre-K kindergarten, right?
Yes. Our pre-K kindergarten curriculum is live on the website, but we're kind of looking forward to getting our first, second, third, fourth, and fifth grade curriculum out there as well.
And we have a lot of counties throughout West Virginia that are using that curriculum in the classroom, either in talking about health, or talking about science, or in some cases it meets the requirements for some of the substance use prevention curriculum that schools are supposed to have. So we're very excited about Rex, and we're working on some new things with him too, some new animation, and so we're very excited. And talk a little bit, and you may not be as well versed in it because you've only been here 30 days, but we also have Rex on the PBS learning platform, right?
Yes, so we do have some videos on the PBS. Like you said, I'm not as well versed in that because I've kind of been working on the Kajabi side of things, but he is basically available for anybody that wants to talk to their kids, or even if you just wanted to show them at home, definitely a good resource to have.
Or if you were a Girl Scout troop or a church youth group and you wanted to access the materials, and then you said Kajabi, but that's our learning management system that the teachers get to access and deliver it in the classroom. So there's lots of different ways to get a hold of this curriculum, which is super cool. So why do you think this program is so important for young people?
I think that it really gives them an insight and something that they can understand, because they're used to watching cartoons, they're used to that sort of animation, and I think that it also gives them kind of autonomy over, they are the person that gets to stand up and they get to say something, which working with kids, I know that's super important. They love to be in charge and take control of a situation, so I think that that's a really great thing.
Yeah, I know that I've done this for years, as you know. We went on the road with Rex. My husband, who was not my husband at the time, and I often were traveling in a minivan, and we brought Rex into classrooms and got to deliver this face-to-face with the students. So it's so great to see how the program has grown and is continuing to grow. And really we're scaling it in such a way now that it can really reach all parts of the state. And we've even had folks from Oklahoma and New York reach out to us about the
Yes.
program recently. So we're really excited that there's the potential there with the PBS partnership as
Yeah.
well for this to go national,
Yeah.
which is super exciting.
Yeah.
So Rex continues to be our medication safety ambassador.
Yes.
So it's very, very exciting. Well, we're going to take a brief break and we'll be right back and we'll talk a little bit more with Macy about a new and exciting program at the Institute. At the Drug Intervention Institute, we are really excited about this new initiative called the Healthy Brain. The Healthy Brain is an inflatable brain that kids can walk through and learn about how the brain works, how to keep their brain healthy, how medication works in the brain, and how addiction impacts the brain. This is an important prevention tool because it can teach kids how to make healthy choices. And so it's geared toward kindergarten through 5th graders, and we're hoping to target all of the kids in the southern part of the state. There are age-appropriate take-home activities for the children, but there's also a lesson plan, also age-appropriate, that teachers can take back and reinforce the things that they learned through the Healthy Brain experience in the classroom after visiting the exhibit. Our hope is to find semi-permanent locations in the southeastern part of the state where children already visit for field trips or experiential activities, and so that this can be an added benefit to those locations, and it can add and enhance the programming that they're already offering to those youth. To be a partner with us or to request the brain for a specific period of time in your semi-permanent location, you can contact us at the Institute by emailing me, susan@wvdii.org, or calling 681-205-2287. With your support, we can make a huge impact to the children of southeastern West Virginia and teach them the importance of keeping their minds healthy. Hi, and welcome back to Healing Our Communities. I'm your host, Dr. Susan Margaret Murphy, president of the Drug Intervention Institute. And today we're here with Macy Withrow, our education director at the Institute. And Macy's been with us for about a month now. And we were just talking about our Don't Keep Rex Around medication safety program that we have. And we talked a lot about how we reach children. So as young as pre-K, and now we're working all the way up to 5th grade. But talk a little bit about why you think this program is important for adults as well.
I think this program is really important for adults too because, as an outsider coming in and kind of learning Rex as an adult would, I think that it's important for adults to know that it's not okay to share medication. I think that that's something that is not talked about enough, but that it's not okay to share their medication with their friends or their family or loved ones or whoever it may be, and to keep those medications away from their children. Candy looks a lot like medicine. Medicine looks a lot like candy, and I think that that's something that people don't always think about. In everyday life, it's like, oh, I'm going to take my medicine. I'll just leave it by my bedside. So I think that that's something that an adult can definitely take away from this program.
And we know that with the large number of children in West Virginia being raised by grandparents, that grandparents are less likely to store medications properly. They're more likely to have an opioid prescription. And they're also more likely to have multiple prescriptions, so a number of pill bottles on counters and tables. But there's also the issue of calls to poison control, right, with kids getting a hold of medication. That's one of the number one reasons why poison control is called. Is that correct?
Yeah, that's correct. For children getting a hold of medication that belongs to an adult or doesn't belong to them, and taking that medicine.
So we recently did something at the Institute, and I know this question's not on here, but I know you'll know all about it because you just did it, but we just did a drug take-back day.
Yes.
So that's an example of how people can get rid of medications
Yeah.
that they're not using anymore,
Yeah.
right?
So we were set up on Capitol Street with a Charleston police officer, and she had a box for us, and people were just able to come and dispose of their medication safely. So they know that it's not going to get in the hands of somebody that may be in active addiction and looking for their next drug, but they also know that it's not going to get in the hands of a small child. So it's very easy to just kind of bring that. I know that there's several pharmacies in the area that also do that on a regular
Yes.
basis, but on the DEA's website, that's where the drug take back information is, and it listed all of those locations. So that's where the updates would be for the next one.
Yeah, and those happen twice a year, I
Yes.
believe, the last Saturday in April and the last Saturday in October.
Okay.
But that's not a reason for folks to hold on to it for that
Yeah.
long period of time. Like you said, some pharmacies actually have drop box disposals in the pharmacy itself.
Yeah.
But you can also either get from us or a
Yes.
pharmacy a
I was gonna
medication
say, yeah.
disposal package,
Yeah,
right?
we gave out several of those as well. We had a couple people walk by and be like, "Oh, I didn't know that this was today. I have medicine at home that I'm trying to get rid of." So we gave away a bunch of those medication disposal kits as well.
Which is fantastic because a lot of people don't realize that you really shouldn't flush your
Yeah.
medications down the commode. You really need to dispose of them properly.
Yes.
So it's a really great way. It breaks the medications down, makes them inert, and then you seal it up and you throw it right in the trash
Yep.
can. So we have those available through the Institute, but most pharmacies also have those medication packets available too. So that's a great way and a great piece of education, I think, for adults that Rex does, is that not only do you need to keep medications away from children, it's about disposing of them.
Yeah.
And a lot of times, in West Virginia, we have folks that are dealing with terminal disease. And so one of the things I've seen at Drug Take Back Day is sometimes a son or a daughter will come after their parent has passed with bags of medication.
Yeah.
And they're just like, I just want to get rid of this
Yeah.
safely. So it's unfortunate, but it's great that they're being responsible, and that's something that they're thinking about. So we're always happy to help
Yes.
with safe medication disposal. And you're going to be talking to around the state. There's an organization called West Virginia Healthy Grandfamilies. And it is an organization that is designed really to talk to grandparents
Yeah.
who are raising grandkids and provide them a number of different supports. But you're going to be talking to them about medication safety. Is that
Yes.
correct?
Yes, I will be.
Yeah. So are you excited about that?
Yeah, I am. I
adventure?
think that that's a really great resource for us to reach the highest population of medication users and
Yeah.
kind of teach them that safety.
Which is great. So it's a message that you can't be too young for and
Yeah.
you can't be too old for.
Yeah.
So Rex
And I'm
is-
also hoping
yeah.
that our students kind of take that back and are able to teach their moms and their dads and their grandparents or whoever their guardian may be and say, well, look what I learned in school today.
Yes.
I think that that's also a great thing for the kids to be able to do.
So it's a multi-generational
Yes.
message, which is great. Well, you're also involved in a very new project. So even though you're
Yes.
new to the Institute, this is a new program as well. So it's a
Yeah.
good fit. You get to launch it and create it and make it your own. And
Yeah.
so we now have a program called the Healthy and Creative Brain.
Yeah.
Can you tell our listeners a little bit about what that is?
So the Healthy and Creative Brain is a massive inflatable brain that children, or really anybody of any age, is able to walk through. They can walk all the way around. There's little tidbits of information, and it's a really great tool for people to learn how addiction affects the brain and how different illnesses and ailments of that nature affect their brain.
So it's kind of like a mini science lesson in
Yeah.
addition to a prevention
Yes.
lesson. But it's also hands-on in that they're actually walking through it,
Yeah.
which is super cool.
Yeah, we've had it at Heritage Farm for the past month, and we see around 100 students a day, and we get a lot of questions and what's this and how's this work, and we are able to actually give the teacher or the parent a book for each student to take home, so they're able to kind
wow.
of take that on and learn more about it afterwards. And we are currently looking for somewhere else for it to go in the colder months.
So the idea is to have month-long or longer residencies.
Yes.
So Heritage Farm, which for those of you who don't know, is in Wayne County.
Yes.
Right on the border of Cabell and Wayne. And the Perry family has been fantastic
Yes, they've
to
been
let us
amazing.
have it there. It seems like an odd location at first when you think about it, because you're like, why are you putting this at a farm? But we have access to a lot of students
Yes.
from 3 states and 10 counties, Kentucky, Ohio, and West Virginia.
Yeah.
And so it's been great to reach those kids. But they have a maker space,
Yes.
right? at
So they
Heritage Farm?
come to the brain and they get to kind of see where all of their functions come from, and then they get to go to the maker space immediately after and use all of those functions. So it's a great connection tool
So
there.
it's a good segue
Yeah.
to their exhibit. And so part of what you're challenged with and looking for is other locations, whether they
Yes.
be museums or community centers, places that see large numbers of children on an annual basis, so that the brain can be placed there and have a residency.
Yes, that's our plan.
That's great. So how do people get in touch with you if they want to do that?
They can send me an email at macy@wvdii.org, or you can access our website at wvdii.org under the education tab, under the creative and healthy brain. That has my contact information there as well.
And tell us a little bit more about the activity book. So when the kids come, they walk through the brain, they get to touch it, feel it, see it. There's some signage around it that talks about how addiction affects the brain and what different parts of the brain do, correct?
Yes. And then in the book, it has some interactive things. So it has like word searches and mazes and those sorts of things, but it also contains a hat that they can make. It's called the cerebellum hat. So they can make a hat that kind of mimics their brain, and they can put that hat on. But it kind of piques their interest because there's a coloring sheets and those sorts of things, but they're also learning while they're doing those things.
And it's messaging and things that the teachers can
Yes.
also reinforce in the
Yes.
classroom. Do you see this as being, like, what age groups is it appropriate for?
It's really appropriate for really anybody, because we've even had adults that come through and say this is so amazing, you know. But really the most interaction that we've had is from K through 5 students. Really the 2nd and 3rd graders are really excited about it because they can try to read the words and they understand the brain and that sort of thing. But like I said, anybody of any age that comes through, we've had some adults that are really excited to see the brain and kind of learn different things.
And so let's say I'm an organization and I say, hey, I think I'd like to have the healthy and creative brain at my location, and I have this month or these 2 months available. What is my commitment level as an organization if I want to take that on?
So really the only commitment that you would need is just the space. We need the space, and that's really it. We take care of loading it and unloading it, and I would be there every day that the exhibit is open. So really it's just the space that we need.
Yeah, so we have the ability to provide some staff help,
Yes, of
some
course.
ancillary programming if we
Yes.
wanted to do it. And so obviously we can't have you there 24/7.
Yes.
That would be impossible. But we do have the ability for some staff support.
Yeah.
And I understand we can also do some branding around the
Yeah.
coloring books as well. Like
Yeah.
if an organization wanted to take it on for a couple months, we can include some of that
Yes.
in our books, correct?
Yeah, of course.
So like their logo and things
Yeah.
of that nature.
Yeah.
Yeah. What else would you want people to know? You've been seeing kids for the last 4 weeks go in and out of the brain. What has surprised you most about that experience?
Just how much kids already know about the brain. And I think that also just seeing them learn and being able to have that interactive learning space is really, really cool.
And what has shocked you? Has anything shocked you?
We go over the spiel before they go in. You know, don't kick the brain, don't punch the brain, don't poke the brain. It's a very expensive brain. We do not want to hurt the brain. And they're all really receptive to that. You would think, you know, you see a bouncy house, they're ready to pounce, but they're all really respectful of the fact that, you know, just like I say, just like the brain in our head, we want to protect this brain.
Nice.
So we have to be gentle with the brain, and I think that that's been my biggest surprise, that they're really receptive to that and respectful of that.
That's great. That's
Yeah.
great to hear. So as you start looking into the next several months in this work, what are you hoping to accomplish? What are some major goals that you have in your head as you come into this work?
With my background in after school, I would really like to see Rex kind of flourish in that aspect. I know that after school directors are always looking for a curriculum that's easy to do and easy to read, and they have it everything lined out and they can just give it to their kids. So I'm kind of looking forward to that and launching the first and second and third through fifth curriculum so that it's widely available for everybody to use. And then I'm also really hoping for us to have a few more residencies with the brain, specifically in the Charleston area, because we've reached a lot of really great schools in Kentucky and Ohio and in the Huntington area. But we're I think that we need to get back down here and get some of those Kanawha and those surrounding counties.
Yeah, and some of this was supported through Kanawha Communities That Care, which is our counties coalition, but also Prestera was and part of our agreement with them is that we're really going to focus on those counties in Region 5. So we're targeting really heavily southeastern, Kanawha County, Boone County, Logan County, Cabell County, Putnam County would be a great location for this as well. So if you are an organization or know someone where the brain might be a fit, we would love to hear from you. Macy's email is macy@wvdii.org. Our phone number is 681-205-2287. Well, Macy, we have a few moments left.
Yes.
So is there anything else that you would like our viewers to know or anything else that you think it's important for our viewers to know about prevention education?
I think that it's important for people to know that prevention education doesn't stop or start at a specific age. I think that there's a lot of stigma around talking about addiction and talking about safety when it comes to medication use. But I think that if we're going to make a really concrete change in the state, we have to start at a younger age. As a person that grew up in this area, I mean, you see it all the time. If you're lucky enough to not have your family be affected by addiction, that's great. But a lot of people are not in this region. So I think that it's really important for kids to know, like, it's okay to talk about it. It's okay to have those more difficult conversations when it comes to addiction and prevention even. So I think that that's something that I've learned since coming into this space, that anybody of any age can learn and become a preventionist themselves.
And that's really how Rex started.
Yeah.
We had 2 children pre-K in Kanawha County that took their grandparents' opioid medication, and Rex was developed in response to that and includes a lot of what we call protective factors in prevention education in terms of talking to a trusted adult. If you see something, say something. And then as we get into older adults, adolescents, we start to talk about bystander intervention, naloxone training, et cetera. So all important things, important work you're doing. So I want to thank you for coming on to discuss it today.
Thank you for having me.
It's been a pleasure to have you. Thanks so much.
Thank you.